So again, thank you for having me. My name is Juan Pablo Segura. I'm one of the founders of Babyscripts. And before I go into what it is that we do at Babyscripts, obviously, our country is in a lot of pain right now. And we at Babyscripts obviously stand with the protesters that are fighting for racial justice and equality in this country. Solving racial disparities is very near and dear to our heart because of what Black women in this country face when it comes to their pregnancy. And so when it comes to just the system that we have in the United States and helping our moms in their pregnancies, I think everyone on this call can agree that it's broken. Whether you look at maternal mortality rates and how maternal mortality in the US is increasing, where in other developed countries it's decreasing, what's really appalling is that if you're Black and pregnant, you are 2 to 3 times more likely to die than your white counterparts. And so, obviously, we spend a lot of money in the space and we don't get the outcomes that we should be getting. And these problems, whether it's C-section rates, preterm birth rates, and preeclampsia complications, a lot of them are multifactorial, but when it comes to access to care, we really at Babyscripts believe that technology can play a massive role in at least solving access to care related issues and problems. And so, structurally, when it comes to access to care in OB, a lot of people know this, but about 50% of counties in the US do not have a practicing OBGYN. There's about a 10,000 provider shortage. So obviously in rural areas, there are a lot of issues, but even in urban environments, Babyscripts is based in Washington, DC. And these are just some headlines of what some of the local newspapers have been reporting on. But in DC, a very kind of dense provider environment, we have maternity care deserts in the east half of the city. And so when it comes to, if you're pregnant in ward 7 and 8, you don't have a hospital, you don't have an OB ward to go to. You have to cross the city, take 4 buses, obviously spend time going through the metro system to just see a doctor. And so again, tech really can start to solve some of these structural problems. And what I think so you can see there are a lot of challenges, but what I think is really promising is that within this patient demographic, you have some really great kind of core assets that we can leverage. Number one is very high utilization of smartphones, more than 80% in this patient demographic. You don't have to convince a pregnant woman to download an app. More than, most women that are pregnant have about 5 different apps that they've downloaded. And what I think is also great is that the space has actually gone through already a level of digitization. So whether it's text messages through Text for Baby, or companies like Wildflower that work with plans and their members, or Ovia that does a lot of patient education from employer to employee, there's been a lot of great work that's been done to try to use mobile as a conduit. But from what we've seen and really some of the gaps in kind of this first layer is that a lot of groups have circumvented the provider and haven't really used the full power of technology. And that's really where we think there needs to be a new generation of tech experiences to manage maternity. And that's really what we focused on when we built Babyscripts about 5 years ago. And so what we've done at Babyscripts is we've created a new model for managing pregnancy care that obviously uses mobile apps, but actually partners very closely with the provider community. And you'll see how we do that in a second. But on top of the app experiences that we offer, we also allow providers to deliver prenatal care at any time and at any place through remote patient monitoring. And we do that by sending internet-connected medical devices, so think blood pressure cuffs, weight scales, blood glucometers, to patients' homes so that we can essentially deliver care at any time and at any place. And so, like I mentioned, Babyscripts has an app that shares and disseminates educational information, provider-approved content. It's an Instagram-esque experience. But on top of our app, we have 6 different remote patient monitoring experiences that are delivered by the provider and that allow us to remote monitor biometric data and other kind of behavioral data points as well. And so this is an example of how we do our remote patient monitoring. We send what are called mommy kits to patients that have Bluetooth connected blood pressure cuffs, weight scales, and that's how we actually deliver this remote patient monitoring that's crucial to the Babyscripts program. So you're probably wondering, okay, so you have an app, remote patient monitoring. How does this actually get delivered? How does this actually work? So we, like I mentioned, partner very closely with the provider community. So what we do is we'll sign an enterprise agreement with a health system, and we'll activate all of their OB clinics. So here in DC, like a GW, George Washington Medical Faculty Associates. And so when we activate all of their practices at a health system, every patient that's confirmed pregnant, so goes in between weeks 8 and 12, gets automatically put on our app. We typically do this through our EMR integrations. And so every new client site that we have actually has an EMR component where we automatically identify and enroll patients onto Babyscripts. And then according to the risk of the patient, we'll actually put the patient in one of our remote patient monitoring experiences, and we'll ship them these mommy kits, like I mentioned. And you can see a patient actually Instagramming the fact that they got this really cool mommy kit in the mail. And so our traction, like I mentioned, we work with, we've been around for about 5 years, and we work with more than 58 health systems in 28 different states. So we touch and remote monitor about 200,000 women a year, which is about 5% of the pregnancy population. And these are a couple of our health system customers and across the country. So pretty large groups, like you can see. And so obviously the work that we do, the remote monitoring that we deliver through Babyscripts is done through the provider. You know, patients take their biometric data points at home through the devices that are automatically uploaded to our cloud, and the providers do all the triage. But what we've started doing is actually partnering and creating, we call them joint deployments, where we not just have the provider and the patient on the tech experience, but we actually start adding managed care, payer sponsors, and even public health departments, and put everyone on the same tech experience, so that it's not just the provider confirming that one of their patients is pregnant, but also allowing the plan know that, hey, one of your members was just confirmed pregnant yesterday. They had a preterm birth in the past. They're hypertensive and diabetic. Your care management team will want to know that. And so a lot of what we focus on is creating this ecosystem to really share data and information in real time from the providers, while also remote monitoring them. And I think that's how you really start getting and solving these access to care challenges. And OB, a lot of these higher risk patient populations suffer from very high no-show rates. And the reasons for no-show rates are various, whether it's lack of transportation to get to the clinic, childcare, the opportunity cost of having an hourly wage and traveling 3 hours to see the doctor for 5 minutes and taking time off of work. And so the question is, how can you start to solve those challenges? And that's really where, for example, our remote patient monitoring comes in. We capture about 40 times the amount of biometric data that's typically captured in the clinic now at home through Babyscripts and the biometric remote monitoring that we do. I think this is very relevant and timely, particularly around COVID. You can see that COVID has forced a severe reduction in the physical interactions that patients have with their providers, even in pregnancy, which obviously is not something that can be delayed. But how do you start to figure out which patients are at risk when all of a sudden a patient goes from having a visit every 4 weeks to every 8 weeks? And again, that's really core to what we do at Babyscripts, and our business has really grown exponentially because of the COVID crisis and the need to really accelerate digital adoption. And this is just an example of a patient intervention that we had where we detected preeclampsia and we saved a patient's life.
My favorite thing about the Babyscripts program was that it saved my life and my daughter's life.
So these are real interventions that can be done. Excuse me for seeing my screen there, but through a remote patient monitoring experience like Babyscripts. And you also start to see how you can specifically address disparities in racial groups. So for example, preeclampsia affects Black women more overwhelmingly than other racial groups. And so we've actually been able to reduce readmissions and complications in postpartum hypertension, which is the #1 reason for maternal death postpartum, through a remote patient monitoring. So we're avoiding cost, improving outcomes, and saving women's lives on something as simple as monitoring blood pressure. So whether it's helping a patient like Megan on the clinical side or the clinical risk side, or helping patients like Diamond, one of our patients that did a testimonial for us on the social and behavioral side, our program actually adapts to the kinds of experiences that providers in their plans want to leverage. And so this is an example of not necessarily an internet-enabled medical device intervention, but we actually change our app experience to create, for example, a bi-directional automated chat where we screen for social determinants and connect patients to local community resources to better manage their social and behavioral risks. And we've been able to double the attendance of for example, routine appointments through our bi-directional chat experience, detect a whole suite of issues and risks. This is a couple kind of patient use cases and examples where we identified some substance abuse in a patient in Pennsylvania, where we actually created through that bi-directional chat a support program that counsels patients that have substance abuse issues, and we connected them to a whole suite of services in their community. And again, that's the joint deployment, leveraging the provider in the community, identifying the risks, and connecting patients to local community resources that they can lean on to help them. Or depression screening, which we did here in DC with one of the plans and the provider that they were going to, where we were able to essentially connect them to, again, mental health support resources based off of the risks that were detected through Babyscripts and at the point of care to the provider. So really our vision and what we're really growing and aggressively kind of targeting is this idea of a joint deployment, which is not just leveraging the provider and the patient together, but bringing in the insurance companies, so their managed care plan, care management, social work, all in the same experience, whether it's managing biometric data or clinical risks to social risks through our chat and our app experience as well. And you start to see not just lower readmissions, blood pressure complications, but you start having lower no-show rates, like what we did at Aurora in their Medicaid clinic on their prenatal side, or reducing the postpartum no-show rate in North Carolina at Atrium Health. So this is all part of the vision that we have at Babyscripts. And I'm pretty sure I hit 10 minutes, or I'm at least pretty close, so I'll stop there.